2025. Good morning. Welcome to your perfect day starter, the morning brief. I'm Kaido Kikilu here in Lagos, and as always, I'm not alone.
And we're live and upbeat for you this beautiful Wednesday morning. Good morning and welcome to the morning brief right here on Channels Television.
I'm Jeffrey Uzama. Thank you so much for joining us. It's 8 days down the line. We'll keep that counting for you. We know that January feels like 31 to 51 days, but we're coming close.
Depending on how much is in your bank account. I'm Bukola Koka, by the way.
So the smart way I found out a way is to, when you keep living, you keep looking for a way to get around this.
Right.
So little things you could do. So for instance, if you're sure of your salaries every month or you're sure of your income every month, sometime around say August or so, you can start putting money aside for January. By the time you get to December, let's even say you're putting 50,000 naira if you earn certain amount of money.
What if you earn minimum wage, Jeff?
If you earn
we need to speak for, the rich.
Okay, minimum wage. How much? Okay, minimum wage. You can start from let's say you can start from earlier than that. Let's say July.
Yeah.
If you put aside now, minimum wage is 70 grand, right? If you put aside for now, if you put aside 10,000, for instance, if you can afford 10,000, and you put aside 10,000 every month till December and don't touch it, you'd have had, let's say you put it down for 7 months. In January, you should have 70,000. You've paid yourself minimum wage to buffer as a hedge against 70,000, the February or the January issues that we always face as a people. So you have 70K in January to sort yourself out till the next salary comes.
It's still not enough to buy a bag of rice, and it's
but at least there's some money in your account.
Inflation would have impacted upon the value of that 70,000 as at that time, such that the value has diminished from what it was when you began saving and what it is when you now have, the money.
Well, I agree, but you have 70,000.
Well, that's not to say you shouldn't save at all.
I think that's a lesson, 2 lessons to take here. Yeah. Personal lessons, and of course for the government, policymakers, so understand the plight of people. Some will tell you that 70,000 naira is finished first week, because you have to do transport.
At least you were able to survive for first week.
First week, that's right. So the point is, you can learn a lesson, save, and then government needs to learn the lesson that, hey, things are not as they ought to be. The basic things really are tough for people. And yes, I think it's a good one because this particular month, as we said, is going to be very long. It's going to be very long. And I think it's because a lot of people overspent in December. I think we just always want to show in December. I didn't really plan to show. I just said, you know what, thank God I'm going to work. So that way you don't have to spend a lot. And I learned this term during the Yuletide, oble.
Is it a song, bro?
So what does it mean? I was going to ask you, Jeffrey.
I don't. Why are you asking me?
Because I know you're conversant with the streets, Jeffrey. What is that term?
I haven't taken my time to know what it means, but I know that as soon as you go to the club or you go to any party and oble comes on, then you go gaga.
So it really doesn't have a meaning.
I don't know what it means. I've never asked what it means. Perhaps the guy who sang, I don't know. Just like Rema did, what does that mean?
Well, I'm just hearing it for the first time, and I'm tone deaf as far as that word is concerned.
You've never heard of oble?
Last year, it was no grief for anybody, and it was apt because of the challenges that Nigerians went through last year in practically all sectors. But this year, what seems to be trending is day for who, day for you. And, and that speaks to being perhaps emotionally available and prioritizing those who are the same for you on that level as well. But we may have to take into consideration those who are disconnected, not just from you, but also from society as a result of all those challenges that we went through last year. We've been going through for a period of time now in this country, and we're still going through, and perhaps are overwhelmed, and we may want to, just take a step back from ourselves, step out and be available for them this year, regardless of whether they're seemingly unavailable for us, perhaps because they're dealing with personal issues. We prioritized mental health on this space last year, and I bet we'll be doing that even more this year as well. So be available for people, whether or not they're available for you.
So we're not just prioritizing mental health, we're prioritizing health as a whole. And that's why we're getting started on the show this morning. Your health, naturally, is one thing you should never play with, whether it's mental, physical, financial, Health.
All of the above.
Never play with it, no matter what. So today we'll be taking a look at the need for reforms that bridge the gap between healthcare delivery and accessibility, ensuring that individuals, regardless of their socio-economic status, have access to affordable, quality healthcare services, and we're not losing sight of HMPV. It's a tricky one. Some call it HPMV, HMPV, but it's human metapneumovirus spreading across China. We've seen it in Malaysia, neighboring countries to China. What is Nigeria also doing about that? Is it a scare we shouldn't worry about? We're big on it on the show this morning.
Yeah, it speaks to our preparedness for the next medical emergency. But that's not all. What about data management? We're going to be looking into that space as well. In a world driven by data, nothing is left to chance. Our focus, as a result, will then be on the pivotal role that experts must play in creating robust data governance models and, of course, protection. Your privacy is very important.
While I was trying to sort out data, if logistics people are showing you shiggy anywhere in the world, or in Lagos or in Nigeria, well, it's a good time to be on the show, so you get to understand how it works for people that provide that service. And it can be quite Herculean task to send anything to anywhere. But we'll break it down for you, for the people in the know, right here on the program today.
It can be annoying when you're waiting for your parfait and you're already salivating and it feels.
And finally on the show, it doesn't make sense, right? Imagine I'm talking and you can't hear me. So we're touching on something really important on the show at the end. No visual story is complete without audio. Imagine us speaking and chatting and you can't hear anything. It's going to be stressful. So we'll be speaking with a Nollywood sound recordist who essentially helps to enhance the pictures you see on your screen and elevate your cinema experience. I think it was quite beautiful yesterday just listening to the different people that are behind the scenes. I mean, a focus finder.
The god of movie making.
So today we're bringing you yet another person who's vital at all of those big movies you enjoy, sound recordists.
As a matter of fact, we'll take a quick break. When we come back, remember your thoughts are very, very welcome. X is the social media of choice. And of course, CTV Morning Brief is how you get to catch our attention on that app. But besides that, we'll bring you some of those things that the dailies have been saying in just a moment. Join us again. Welcome back. Let's take a look at what the dailies are saying. I'm being joined in the program by Mr. Blessing Anaro, editor, Southern Operations of Blueprint. Thank you, sir, for coming on the program.
Thank you for having me.
So there's a lot going on in the politics, as always. So just binge on all of them. Maybe let's start with your paper this time, Blueprints. And main headlines here as Ghana's Mahama returns to power. Tinubu rallies African leaders on shared hope. I know that he made some categorical statement yesterday about Africa doesn't need anyone's validation. Your thoughts?
Yeah, that's right. I think the return of Mahama back to power and Tinubu there for the inauguration is a good sign for West Africa region. The two nations are in the forefront of actually driving activities in West Africa, and the cooperation between two of them will go a long way. And from the speeches both made yesterday, it is very clear that two of them are in tune, they're in sync with what to do with West Africa. Now that we have some little, what do I call them, bad sons that are into military and the rest, two of them will be able to rein them in and put heads together and do West Africa great again.
I don't know whether you noticed that the president of Burkina Faso was also there, the military leader. How did that feel?
Well, they are brothers. I think they are thinking that we're brothers. They are trying to rein them in back to democracy. So their presence there means that there's actually cooperation and that something may happen possibly, making democracy back to them, to those countries again.
All right, let's go to the Daily Sun. The main story there says Atiku Labour Party, that's LP, activists condemns threat against Peter Obi. Ex-Vice President alleges shift to authoritarian governance. Moka, APC spokesperson, denies issuing threat. I'm sure you follow this story clearly.
You know, I think this is all politics because Obi came to say the other time that, look, if anything happened to me, hold him responsible, that he's saying that he will come after you. And Moka said he has not said anything like that. So the whole thing, I think it is political. For me, whoever person is in power for the next 4 years or so will better join hands together because the country will have only one country. So for us to be trading blames left and right, it is better that we are focused on how to build Nigeria, not our individual selves, not our parties, though there's need for diverse views. But basically, these stones they throw around each other publicly, I mean, it makes people feel that there's something really serious happening underneath. But looking at the whole thing...
So there are two angles to it. On one hand, some are saying this is what democracy should be, criticizing the government in power to do better. He made some proposals. Others are saying you're running the government or the nation down. What's your perspective?
No, that is why we have opposition parties. And that is when you have the ruling party, you have the opposition. When you hear the opposition criticize, you go back to your drawing board and you say, okay, let us look at this and look at that. But it should not be seen as something as if this person wants to bring me down. I'm not sure this government is even taking like that because they have allowed a lot of people to have their say. And even when their assistants come out to counter with different ways of war, the presidency have constantly, I think, maintained what it's doing and taking correction in most cases.
There's a story just on the front page of the Daily Sun, just beneath it, I think it's in page 4. Police arrest 19 suspects over a war-called clash. And this is important because remember when I was in the news for that very attack, and yet again we're seeing this happen. I don't know what your reaction would be to this.
I think it's a good development in the right direction because I think I also got to know that the governor has already imposed a kind of curfew in that area to make sure there is no movement to contain such violence happening, not at this time when we're thinking of how to move forward and you have some people with different mindset coming to bring in this kind of violence and the rest is bad news. And the police intervening is just one of the best things that can happen.
Let's head to the front page of the Vanguard, just below the nameplates. How lack of power, water, Jagba degrades health sector. I think this is almost a recurrent decimal. We've been on this for a while, Mr. Naro.
Yeah, Jagba, lack of power and all that. We've been on this for quite some years now. It's not actually new. And from what I can see, the present government, I believe, they are trying to put things in order to ensure that when these are put in place, there is power, there is water, then I'm sure there will be more productivity. And when there's more productivity, then I'm sure there will be more better economy. And the Japan syndrome, I'm sure people will start coming back soon because what happens now can never last forever.
It's interesting to see that the picture on the front page of the Vanguard, I know it's also on the front page of the Daily Sun, that shows former President Olusegun Obasanjo exchanging pleasantries with President Bola Tinubu.
Why not? Why not? Both of them are statesmen and they may have differences, but they are always together for the sake of the country. They meet, they dine together. So if anybody says that they are throwing tantrum or something, no, it's just for probably making sure that we are moving forward. Because if, as you hear now, your best friend will not tell you that, man, your mouth is smelling, then who else can tell you? So when they do that, those sometimes to not be public, but I assure you that they are best of friends and they meet and they discuss this country on how to go forward. It's normal.
All right, we also have on that, I wanted to move on, but I just saw that on the front page as well. Just besides those pictures, we have gunmen abduct 46 in Zamfara community. It's very troubling, the things that happen. There have been some successes recorded, and Bell Authority has been told your days are numbered, but we're still seeing abduction, Mr. Naro.
Yeah, it's quite unfortunate. is quite unfortunate because we're talking about human lives here. We're talking about disruption in human growth and activity. And we also have seen our Air Force strike every day, scores killed here, scores killed here. And we know that this issue, I'm not sure it's actually a Nigerian issue because I think there are foreign people involved in this whole attack, trying to destabilize our polity. And from what I read every day, the armed forces are doing their best. It's kind of a war. It does not end in one day. But if they continue the onslaught against these bandits, I'm sure victory is very close.
Let's head to the leadership. Quite some interesting headers here on the leadership. But the main story is that governors shake up cabinet to assert control. Will the big stick after non-loyal appointees? Mohammed sacks 5 commissioners. Rather, redesignate portfolios in Bauchi, Katsina. Sule explains cabinet sack in Nasarawa. What's going on?
Yeah, I think that is one of the most dynamic.
Trying to put their political warlords.
No, very dynamic. I expected that in a government, if you have commissioners you appointed and you look at the year, who have performed, who have not performed, then the best thing to do is to reshuffle and to make sure that as we enter another year, we'll get better results. So I think that governors are just done well. And there's nothing wrong with reshuffling or bringing somebody new, fresh brains to do what is next. But the people are not really, they are always on your neck. Do better for we want dividend. So
sometimes, is it about performance or is it about trying to put the foot soldiers ahead of the next election cycle?
Well, I think if you look at
grassroots men.
No, not necessarily so. You know, so we have the right to think from our own prison. But naturally, if we were to be a leader in such a place, and you have pressure from different constituency, we are not getting this. NEPA is not doing well. And who is the minister for NEPA? You may want to change him. So I think everything is not about politics. Though there may be politics, but if you were there, I'm sure you would do it for the interest of the people.
All right, there are 2 more headlines on the leadership that I want you to speak to or comment on. The other one had just somewhere down the nameplate. It's a military veterans occupy finance ministry over unpaid benefits. I think this is like the second time I'm hearing this story. What exactly is going on with that?
The second time. So when I saw the story yesterday, I asked myself, why go to the finance ministry? Probably they went there because they know fully well that maybe approval will be given. And maybe protocols and bureaucracy have made the money not to come out to them. And so they went there to protest because I am sure the president made a statement the other day that those that have served the country, they have to be paid, and maybe he has passed giving the approval for them to be paid, and bottlenecks from ministries have delayed, and probably if not, they will have gone to the presidency to protest, but they went there believing that the source of their wahala is from that place.
Okay, also, just before I touch on other dailies, FG issues advisory on HMPV infection and prevention. I hope we don't have another pandemic on our hands.
Yeah, I hope that somebody don't import it again like it happened during the COVID.
Really import it again.
So that somebody will just come in and slip into the country without probably checking properly at the borders, at the airports. So what has happened, say one child or twice beaten is something very bad. So because we have experienced it before, I'm sure the federal government and other agencies should put us together to make sure we tighten our borders and we are very watchful, because we are even more vulnerable than the China that is coming from. They have.
What is it about China and being origin of some of these diseases? What is going on?
Too much scientific testing and knowledge and could bring us this kind of things. Yeah.
Let me begin to wind down with the New Telegraph. The main story here says, we shall lift our nations out of poverty, build resilient economies. That's President Tinubu. When you aggregate the leadership of Africa, about 54 or so of us, does it align with this statement?
The statement is something that has to be matched with action. The statement has to be something that has to be collaborative. We're talking about Africa. He's speaking as a leader in Africa. If everybody in Africa could reason, could come together, because we have foes, whether you like it or not. if you want to move forward, there are people that want to benefit from your problems. So if we really put our ass together, and like I said, we could do better than this, and we have every potential to be better than any nation in the world. So why not?
Well, we'll get to see. It's more work than talk, as people will say. So I must thank you so much, Editor, Southern Operations of Blueprint Newspaper, Mr. Blessing Anaro, for your analysis of the dailies. Thank you so much for coming on the program.
My pleasure. It's my pleasure.
And we will take a quick break now. When we come back, our very first conversation has to do with the health sector. Stay with us.
The health scare of HMPV in China to the skyrocketing cases of flu in the UK. It's not just flu, actually, in the UK. There's a COVID scare, there's norovirus, and the rest. Health is taking a huge space in the headlines today across the world. So Nigeria is not being left out. How well are we able to handle these medical emergencies and the everyday health issues? What is our structure like in 2025? We're joined by three gentlemen on the show this morning. Professor Innocent Uja, Vice Chancellor, Federal University of Health Sciences, Otukpo, former DG of the NIMR, that's NIMR, former President NMA, consultant ONG, and the rest. He joins us from our Abuja studio. Professor Uja, welcome to the morning brief. We also have Professor Issa Sadiq Abubakar, who's a professor of infectious diseases and public health at Bayero University, Kano, professor of community medicine, Bayero University, Kano. That's the HOD, Public Infectious Diseases, joins us from our Kano studio. Professor Sadiq Abubakar, welcome to the morning brief. And you've been seeing Dr. Kukoyi, who's right here in our Lagos studio. Dr. Wale Kukoyi is a general physician, former chairman of NMA, Ogun State, and governor, Rotary International District 9111. Gentlemen, welcome to the morning brief.
Thank you very much.
It's really tough here, but let me just begin with Professor Innocent Uja, and just get your at least your position on how we were able to handle medical or health emergencies, and HMPV naturally comes to mind. The NCDC says, well, we're ensuring that we keep an eye on this, but are we really well equipped, learning from COVID, to handle these health emergencies like HMPV? Professor Uja.
Well, thank you very much, and good morning and Happy New Year. Let me just first of all thank channels for continuing and sustaining education, health education and information to Nigerians and to other communities. Well, the issue of emergencies, medical emergencies, will continue to come, and we should be ready. When Ebola came, nobody gave Nigeria a chance. Fortunately, by His grace, we were able to overcome that. COVID, yes, COVID came. We did our best, and I believe that that best was okay for us, comparing us with other nations of the world, particularly United States and United Kingdom. The HMPV that is raging now, well, I think that the Nigerian Center for Disease Control is trying to update and then put its emergency operations center at alert, so that we need to start immediately, put all the plans, emergency plans and programs together in readiness, because we think that we have opportunities. Fortunately, I think we have had some experience from Ebola, from COVID. And in fact, if you looked at some of the things that happened earlier, like the polio virus eradication, where every instrument has to be used, using traditional institution, formal and informal institution, sensitization is important, and the National Orientation Agency comes to mind very easily. We need to use air, land, and sea operation, getting ready for any eventualities. So whether we are ready, well, we have opportunity, and if we should put our opportunity into action, I believe that we should be able to contain it. And of course, our ports must be at alert. The health ports, port health should be at alert and be vigilant to ensure that, just like somebody said, so that we don't have any importation that will affect Nigeria. Of course, the health system is not at its best, but we can, with the workforce that we have, I believe that we could do better and be prepared for the HMPV.
Instructive words you said there. And looking at one of the front pages this morning, you would realize that indeed our health sector needs a lot of work. And I think this goes without saying, really. So let me just quickly go to Professor Sadiq Abubakar. And still staying with the HMPV, I recall in the UK, for example, they say they're dealing with the quademic. As I said earlier on, they're dealing with the flu, the common flu, which they have over 5,000 cases daily as at the last count. They're dealing with COVID-19. They're dealing with norovirus, and they're dealing with RSV. I think that's a respiratory syncytial virus or something like that. So the UK health system, the NHS, is overwhelmed. It was overwhelmed before, but now imagine they are overwhelmed. So maybe you give us some more insight into what HMPV is all about, Professor Sadiq Abubakar. How worried should we be on a scale of 1 to 10? That's on the one hand. In terms of research, being able to also flag it, how prepared are we? And, well, maybe you can give us a prognosis of this HMPV as well, Professor.
Thank
you. Prof, I can't quite hear you, so we may just need to resolve that, because this is a very vital question. So people are well informed about what this is about. There's a lot of scare right now. People thinking, is this COVID all over again? Are we going to see lockdowns again? There's no vaccine, for example, for HMPV. So let me come to you, Dr. Kukoi. I will wait for Dr. Sadiq Abubakar. You're a general physician as well. I don't know if you've seen an uptick in the cases of maybe flu or flu-related diseases coming into the hospital, but you also have a front seat view of our health systems across board, so from primary to secondary to tertiary. So let's break it down.
Well, thank you very much. Once again, I want to join Professor Uja to thank channels for bringing public health issues to limelight. Of course, we've been reading of the scare of MPV virus and all the other respiratory diseases. Well, we all know that in these parts of in this time around, we have a very dusty atmosphere, climate, and everything. Respiratory illnesses usually are common here. But then there seems to be an upsurge in the incidence, and that tells us that we should be extra careful, more so that we have surveillance all over the world showing that there's an increase in all of these things. We don't have to wait until we have a grave situation in our hands, and that is the essence of taking proactive action. And I think we need to bring up the system that we had in the past, that you recall during the COVID and Ebola, all of that. Somehow Nigeria was able to contain all of this. The structures are still on ground, but we need to reactivate them so that we can actually nip all these things in the bud. There's a growing concern over these public health diseases, and we need to take proactive and active actions in order to contain them.
Well, I hope Professor Sadiq Abubakar is ready to just give us his thoughts on this as well. So you can go ahead. I was asking about on a scale of 1 to 10, just how should we be worried? How worried should we be? You can measure this against COVID-19. And also I was asking about how well we're able to track these. That's for you, Professor Isa Sadiq Abubakar. All right, Bukola.
Human metapneumovirus, which is...
Do we have Professor Abubakar back now? I think I can hear his voice. Okay, if he's not back, we'll return to them. But, listening to Professor Uja and Dr. Kuko is quite instructive. Professor Uja says we should, be better prepared. But there's a difference between what should be done and what is actually on ground. You say we already have it, we just need to reactivate it. But if we reflect on some of the challenges from COVID-19, delay in getting results, the few medical laboratories available for the tests and all of that, creation of emergency centers because of the weight, the magnitude of the numbers of COVID-19 patients that we had at the time. Do we actually have what can be activated in case there's the next medical emergency, which no one is praying for? And I'm talking about laboratories, I'm talking about protective gear for medical personnel, and even the numbers in medical personnel that can respond to the next medical emergency. Can we say that the investment of the new administration in the last 1 year plus is commensurate with what is required for preparedness for the next medical emergency? Dr. Kukoy.
Yes, I think we should start from the area of budgeting, because that tells us how determined or serious any government is about health issues. Yes, our budget is over trillions now, but how much of this is devoted to health? That is a critical question that we should ask ourselves. Over the years, and when I say this, I'm talking about between 2012 to 2018, the allocation to health has been so poor, declining from about 6% to a paltry 4%, for instance. That shows us that we have a problem. Compounding that is the death of human resources. I mean, everybody knows that the level of human resources we have now is very low. We'll talk about the Japa syndrome, for instance. Most of our critical human resources have flown out, and that is a source of worry. Apart from that, infrastructure is also critical. There's no doubt that the infrastructure we have in most of our, especially public institutions, is poor, and it will certainly not be enough to contain any pandemic now. That is why I said we have to reactivate all of these things, and don't wait until we have a problem on our hands. Supply of equipment, of consumables, I mean, all these things, also taking note of the economy now, all these things are very, very important and critical. On a scale of 10, like you asked, I would say I don't think we are measuring up to 5, and that is an alarm that warns us that we should start getting all things ready and right to be able to contain any pandemic that may come. So it's a grave problem.
But if you consider the administration's policies is not a problem of the lack of policies, but what about the results?
Definitely not.
There was the launch of the Basic Healthcare Provision Fund last year. In November 2024 as well, there was an approval of 45 billion naira for the construction of primary healthcare centers. I believe earlier in the year as well, there was an approval of a fund for the provision of the rehabilitation of primary healthcare centers across the country. But what are the results that you're seeing in, from these policies? Well,
management of the fund is another grave issue that we have to critically analyze. Yes, it's good to allocate some amounts to some activities or projects, but how much of this actually gets into all the expected things? So these are some of the issues that still bedevil our health system. And I think all of us should, as Nigerians, just determine that we must get it right this time. Not just the health professionals. What of the health administrators? They're also very important in the whole system of health management. So all of us have to gear up and be ready for any eventuality that may come. maybe in the past we've been lucky, but then we should not put everything on luck. We should actually get to the basics and do things right, as expected.
Yeah, and that's quite instructive. Yes. I'm told Professor Sadiq is available for us now from our Kano studio. I believe you've had good time, to listen in on the conversation. We'll be looking at the level of preparedness for the next medical emergency, trying to tie it with what is on ground as against the administration's policy responses. Are they commensurate? Do you see results? Should there be another medical emergency in terms of what has been put on ground in infrastructure and human resource?
Well, thank you very much. The way I see it, this administration is still new with its renewed hope agenda. And in the health sector in particular, the driving force is the Health Sector Renewal Investment Program, which is trying to bring sector-wide approach. And a lot of plans, a lot of policy statements have been made, but we are at the early stages of implementation. So it is very premature for me to come out confidently and say that these policies are able to match what is happening, especially in the area of emergencies. But we hope that the government, as well as all stakeholders working to improve healthcare, will put their heads together and walk the talk. By this I mean that everybody who has a responsibility or a role to play in the fight against all emergencies should come together and work in alignment with the sector-wide approach that is in the health sector. If all play their own part very well, I believe that we may be able to tackle the problem, and then we'll be able to contain the epidemic, even if it comes to us in good time. Right now, the World Health Organization is yet to make any declaration of a public health emergency of international concern regarding the human metapneumovirus disease. But then the fact that China, along with other countries, have counted many cases, we are not to relax and wait for it to come to our front door before we will act. Just as my other colleagues have been saying, this is the time for us to act and bring all our resources together and then move into action so that we will not be in trouble with the disease. It is not a new disease, but then, this one thing with these organisms is that sometimes they can mutate, that is, change their configuration, and they can become more vicious. We do not know yet. This is early for us to know whether it is going to be more virulent than the previous strains of the virus. However, a lot of studies need to be done within and outside the country. The country where this epidemic or this disease has reared its head from, that is China, should be transparent with sharing of data and experiences so that other countries will learn from it. And of course, our country, being one of the countries with the largest population in the world, need to benefit from knowledge sharing with countries that have already experienced these cases. And in any case, we do not even know, even in our country right now, whether we have some cases. So it is very good that NCDC has woken up and is calling on all health workers to have high index of suspicion, especially among cases which come to the hospitals with respiratory symptoms. So people should have high index of suspicion of diagnosing this disease, so that we can do the needful. The needful being that cases should be treated, and then people should be isolated for confirmed cases, so that they will not serve as a source of infection for others. So by the time we do this, we are able to detect it early, being able to control it, and being able to prevent or protect those that are yet to be affected, then we may be out of the troubles, especially protecting the people that are most vulnerable. That is young children, the elderly, and those whose immunity is compromised. People with weak immunity. They are the ones that suffer the most severe form of these diseases, at least in countries that have reported cases so far. So these people need to be protected. We don't have a vaccine yet, but then we can apply public health measures of, for example, regular hand washing, avoiding contacts, especially with people who are exhibiting respiratory symptoms, and then wearing face masks, especially when we are in public places.
Right.
And then if we feel unwell, we need to stay indoors so that we cannot continue to spread the disease.
Well, it's important to take note of those measures, and thank you for the reminder yet again. I'll take this to Professor Oja, and as I said earlier on, even the UK with its NHS is overwhelmed at this point, and that's a country that you have doctors from Nigeria japa into, in that sense, as one of the countries still overwhelmed. So you wonder how Nigeria is still just finding a way to get by. Some say it's a miracle. Nigeria itself is a miracle. But it points to one thing, the fact that healthcare comes at a cost. And most times it's expensive. Healthcare is perhaps one of the most expensive. You want to get, for example, a CT scanner or an X-ray machine, you know how much it costs. And these things are vital to providing quality healthcare. And that's why you have some doctors saying, well, I'm not being paid well enough here, one. The environment is not as conducive. I don't even have the tools to work with. So how about I just go where my skills might be more valued? So in this year, 2025, seeing all of the challenges and the ones that may come up, how do we deal with this issue of funding, getting the right funding for healthcare sector from primary to secondary and tertiary? Professor Oja.
Well, thank you very much. Before I go to that, let me just give the experience we had during Ebola. I had opportunity to have been invited to many countries, conferences, after the successful containment of Ebola in Nigeria. And they asked the question they asked is, how did Nigeria do it? And I told them there were 3 C's. The first is the unity of command. That is the political will of the presidency. The second is the coordinating ability of the ministry, and that is the minister. And then the third is the commitment of health workers. So if we have this in place, we should be prepared for a good response to emergencies. But however, between then and now, so many things have gone wrong. Many people have japa, no more experiences. Those who had the experiences have gone. And there's no doubt that we need to reactivate so many things and retrain those who are on ground. So if we are able to do that with the NCDC and the Nigerian Institute of Medical Research and other health research institutes, I believe that we should be able to contain many of the emergencies. But it cannot be done, just sitting and wishing. Miracles have happened in Nigeria for a very long time, but I think we should not work still on miracle. First of all, the primary health care facilities. There are no doctors in the primary health care facilities. And I don't see how it can be easy to get this implemented. As we move on, fortunately, we are told that there is autonomy now in the local governments, and that is where we need to come in. The issue of funding, and then, of course, the deployment of the workforce. We must put that into proper perspective. I know that the issue of leadership in the primary health care facility had been tested, using the governor's performance, which was done sometimes, on 2 occasions. So we need to work very, very hard. First of all, as we heard, the budget is just about 5% for this year for health. And that's totally not adequate. And we need a lot of other sources of funding. The National Health Insurance Scheme, our National Health Insurance Agency, comes very, comes in handy very easily. And we need, many people are still not enrolled. And we need a lot of sensitization. Like I said earlier, let's use all the facilities available, either traditional institutions, the National Orientation Agency, so that people can be registered, enrolled with the National Health Insurance Agency. The truth of the matter is that health is very, very expensive, now more than ever before. I remember that a few months ago, no, about 2 years ago, I had a case where we had to prescribe a drug that was about $5,000 per vial. Today it's $50,000. I mean, not dollars, naira, sorry. If that is the case, I don't see how many people that can afford that. Particularly, many of the drugs that we have are actually adulterated and substandard. And I hope that NAFDAC will work very hard, because at the moment all we hear is that the drug is safe. If it's safe, is it effective? That is one area that we need to talk about. The issue of funding is very important. We need to escalate our activities on National Health Insurance Scheme. It's also true, and I have advocated, that all we're talking about, particularly to prevent medical tourism, we must establish state-of-the-art hospitals for specialized care, just like they do in India, Apollo, Fortis, and many of these are not government-owned, they are private-owned, but the enabling environment is created. And I've been advocating for Bank for Health and Development, which will now be like Bank for Industry and Bank for Agriculture. In that case, private sectors can then participate effectively by getting low interest rates and build state-of-the-art facility. The federal government alone cannot do it. That is a fact. Those who would then get those specialized care would then reduce the burden on the public health facilities for those who probably may not be able to afford the private sector management. So, by and large, we need to re-strategize. I've also said that there must be a summit on health summit to really address issues of health in Nigeria. Because at the moment, yes, there are policies, but policies without effective implementation is like potential without kinetic energy. We need to move from potentials to kinetic position. It's not enough to have too many policies without, for instance, medical industrialization is very, very important. Improving medical industrialization is very important. But how do you get that? We cannot manufacture drugs almost immediately, and therefore there should be duty-free on health and on drugs and consumables for our people to be able to get this. The other thing is the issue of food insecurity. At the moment, there is a lot of poverty in the land, and the people that will suffer it most are children and pregnant women. Children will suffer malnutrition, pregnant women will suffer anemia, they will suffer miscarriages, and low birth weights will be produced. So there are so many angles that we can look at this. So I believe that one of the things that should be done is to look at the duty on drugs and consumables. We should have people to be alive before we talk about the money we generate. I believe that the federal government can do well by reducing duty, or even let drugs and consumables be duty-free, so that our people can receive the best of care. Things are very expensive. And then talking about the Japa syndrome, that on the situation now, as it is, nothing will bring many of our people who are there back, because the conditions for which they left has not improved. And I want to advocate that the federal government and states, because we're always talking of federal government, the state governments should make deliberate effort and strategic effort to have policies that can bring people back. We had this in 1978, we had 1992, and what happened that people who went to Saudi Arabia in the 90s came back. The government should look at this. The enabling environment, security situations, of course, I think that there's improvement in the national security situation.
Right, Professor Oja. When you say that there's so many angles to look at it from, if we examine this from the point of view of how cholera, which is a treatable disease, has been handled, we'll wonder what would happen if there's a next medical emergency. As at October 2024, Nigeria had recorded 359 deaths for cholera, and that's a lot to take in. You talked about inadequate funding, that is only 5% of the budget of 2025 that has been dedicated to health. But I wonder if that has more to do with accountability, because if you considered, again, I refer to the Basic Healthcare Provision Fund, the Minister of Health had said that $2.5 billion would go into that from the Consolidated Revenue Fund between 2024 and 2026. And how long will it take, on the other hand, for President Tinubu's landmark executive order on the reduction of tariffs for healthcare products, machinery, importation, to kick in, to begin to take effect, such that we can see a reduction in the price of manufactured goods, either it's imported or it is manufactured here in Nigeria? Professor Sadiq, I'd like you to reflect on those points, very critical points to the health sector.
Okay, thank you very much indeed. Actually, funding of healthcare in Nigeria, it was in this country in 2001 that presidents and heads of government of African countries met, and they declared that at least 15% of their annual budgets will go into health care. But in Nigeria, where the meeting took place, it had never been. And we always look forward to a time when this will happen. And since this was like evidence-based for it to be that if we want adequate funding, then this is the list we should provide to the healthcare, and we are not providing. So now the Minister of Health mentioning a huge amount of money is an important development, and we welcome that idea that with the goodwill of friends of the government, the minister being one of the active players in ensuring this has happened, with the support of the president. We believe that a lot of funding is coming into the health sector. But then again, judicious utilization is one area that we need to work on. That is, and that doesn't stop with the president or the honorable coordinating minister. It is all of us, especially those that are at the helm of affairs in different ministries, ministry department agencies within the health sector. Now, if we ensure this, then there is we will have a situation where a lot of achievements will be made in the different areas we need improvement. And I hope that everybody's hands will be on deck so that we will do the needful and see to it that there is some improvement in this regard.
Dr. Kukoi, you have similar thoughts or different thoughts?
Well, I also want to chip in one or two things, especially about funding and management of the fund itself. Well, if you look at situations around the world that have universal health care, the backbone is health insurance. We've been talking about health insurance in Nigeria for over 20 years, but somehow the uptake has not even reached 10%, and that is a grave situation. Today, most of the funding in health is out of pocket, over 70%. If you consider that in relation to the economy now, how costly and how expensive things are, you can imagine how people who are not covered by health insurance survive. It takes a lot of money out of their pockets, and that is a grave thing. I think we should strengthen the national health insurance. It started with the scheme, now the authority, and I assume that the authority should have more power, to enroll more Nigerians into the health insurance thing. That will be a very vital step to take in terms of funding. But again, as has also been alluded to, it's just not enough to allocate funds. It's also enough to manage the funds very well. We need transparency at every level of health management, be it primary, secondary, or tertiary. We have a lot of wastages across the line, and this should be contained. I think if we are able to manage the resources that we have, at least things will get better and improve. Unless we do that, the other thing I want to point out is that we need to strengthen our horizontal healthcare. If this is strengthened, when epidemics or pandemics come, then we can put vertical approaches on top of the horizontal. The horizontal approach must be strengthened, which means that across all the 774 local government areas, health centers, we have the basic things. Of course, we know that most diseases are at the primary care level. But if the centers are not strengthened to treat those cases, it's going to cause a lot of problems. So I think what we should be stressing right now is to strengthen horizontal health approaches, that even if pandemics come, we can now activate our emergency measures. At least we have the basic ones, which will cover most of the things that are needed in such emergencies. Thank you.
There you have it. Looks like 2025 will be a very interesting year, and I really, really hope that our health system is stronger to manage it. But we have to thank you so much, Dr. Wale Kukoyi, General Physician, former Chairman of NMA Ogun, and Governor Rotary International District 9111. Thank you for your time, as well as Professor Issa Sadiq Abubakar, Professor of Infectious Diseases and Public Health, Bayero University, Kano. We've also had the pleasure of having with us Professor Innocent Uja, Vice Chancellor, Federal University of Health Sciences, Otukpo, and former DG NIMA, former President, NMA. Thank you very much for your time and for giving us heads up, at least, about this HMPV. Thank you once again.
Thank you very much. Thank you very much, Abba.
Well, we'll take a moment now. We're not taking our eyes off HMPV, but there are other issues we have to deal with. So stay with us right here. It's the Morning Brief.
All right, welcome back. Let's get to our social media of choice, which is X, to find out what you are saying and what you've been, permit me to say, tweets you've been tweeting about, but it's an old name. Let's get straight to that particular very sad incident that happened in the nation's capital, Abuja, where 2 persons have now been confirmed dead. It's a developing story due to that explosion in an Abuja school. The school is Sangagia Sani Udman Ismailia School, located in Kuchimbuyi village in Bazin area of the FCT. So the first user here says, Nigerian noise, that's your name. 2 men with IED, they were tampering with it within an Ismailia school in one village suburb of Abuja. It blew in their faces. Ejen Nwere says, what's stopping security agencies from establishing their presence in that village? That village has been ravaged by kidnappers for 2 years back to back. The village recorded over 9 kidnapping cases in 2 years and 3 deaths, even giving names like Wale, Pajimo, Austin, the banker. So those are some of the reactions as far as that explosion is concerned. It looks like that has been a place where we've had some situation in the nation's capital. And maybe this is an SOS to the Honorable Minister of the FCT to swing to action. Let's get to the next user. Say Ikin says preliminary investigations revealed that 3 men from Katsina had visited the owner of the Islamic school. The 3 visitors are suspected of having brought explosive device with them. Tragically, 2 of the men died in the explosion while tampering with the IED. One is wondering what they are doing with an IED in that particular school. So that means that there's a lot more to be investigated as far as this is concerned. M2H, his Adam says, how did the bomb go to the school? Manufacturers are there or what? Big question. What is an IED doing there? The authorities and the police authorities in the FCT should be able to give us clear answers so that we can calm frayed nerves and bring calm to that area, because I'm sure people may be a bit anxious hearing this particular kind of story in that school. But that's not all you've been talking about. We also move on to what happened in Accra, Ghana yesterday, where former president, now the incumbent president, John Dramani Mahama, was sworn in alongside his vice, Nana Jane Opoku Ajibang. Yesterday, as president and vice president, we had President Bola Tinubu giving remarks as a special guest of honor. We had also other leaders of Africa, about 20 of them, and people from the diplomatic community. We even had the military leader of Burkina Faso also there. So, Young Blessing Tommy says, Ghana's democracy continues to shine as an example to Africa and the world. Congratulations to President Mahama. May his leadership prioritize the well-being of citizens and the growth of the nation. He says he's going to restore the country to 24-hour economy. They are highly indebted. Didier Sixtecal says, I pray this is the beginning of great things for Ghana. No reason the country shouldn't take off. Kobe Slow says, JD Mahama, congratulations. The pride of being Ghanaian is fully restored in your second coming. You brought the whole of Africa to Independence Square. Nana Your Infinity, I guess this is a Ghanaian, it says he had 57.7% of the total vote cast as opposition, the highest in the country's history. The incumbent had 38%. Ghanaians don't play with the election. Okay, we need to fact check this particular number. Okay. So that's as far as the issue of Ghana is concerned. It was a landslide victory for the NDC, beating the incumbent party, that's the MPP of Nana Akufo-Addo and Vice President Bawumia. But let's come back to Nigeria, where we understand that the President, Bola Tinubu, has approved $20,000 medical allowance and other perks for retiring military chiefs and generals. Brother John says that's your name on X, Nigerian God _ that's how you call yourself. What about those retired as corporals, the corporals that are sent to volatile areas? Big question. Johnson said, while feeding again those already belly full, Mr. President. So that's like pigeon in Nigeria. More like, why are you giving more to those who already have? This money could have been channeled to the welfare of young soldiers and middle cadre officers, especially those on the battlefield with bandits and Boko Haram insurgents. Olubumi says, His Excellency, I guess that's what you wanted to say, should remember our fathers and mothers that have the nation, that have served the nation too. He should urge the state governors to do same. Not only the generals have served the nation. While this is going on, some retired military officers are at the Ministry of Finance headquarters in Abuja protesting about issues around their welfare. So it's just a different part to this whole conversation. On one hand, big approvals for the generals and the chief. On the other hand, the pensioners are screaming that they need better welfare at the end of the day. Okay, Flagger _M says, but civil servants receive less than $1,000 after 35 years of service. I know where that is coming from. So a lady was online on X where she talked about how much was her gratuity. I think it's about 1.5 million after serving the police as a DSP for 35 years. She retired and she was given 1.5 million, which is like $1,000. And her pension is about 40,000 naira. And we need to do better as a country. I know we complain about paucity of funds, but for the men and women who have put their lives on the line, I understand what the people are saying, that just beyond the generals, the ones at the lower cadre of the hierarchy should also be served better. Okay, where do we go here? I see Meta is ending fact-checking program in the US and replacing it with community note system. This is more like bringing in contributors so some editing can be done, just to make it a bit more robust and give it a community perspective such that it's not just third-party fact-checking. John, you said community notes can work well if balanced, not to allow the same people vote down notes they don't agree with. Works on OK, on X. Elon Musk himself is often corrected factually with a community note. So Elon has literally taken over Twitter, almost like he bought it to talk. But hey, it's a space and he does what he does. So those are the stories we've been tracking for you on X, which is our social media of choice. We'll take a quick break. When we come back, we'll bring you more conversation right here on the Morning Brief. Stay with us.
Welcome back to the program. And as we move on, we're looking at another space that is very interesting for entrepreneurs, particularly with those who are looking at, okay, what space, can I make impact and, stabilize in terms of economic empowerment? It's the logistics space. And believe me, it is very wide. So how wide is it? Let's explore it together this morning as our guest joins us. She is Omomi Omoshendemi, co-founder Fast Riders. Good morning and welcome to the program.
Good morning. Thank you for having me today.
We're glad to have you. So how fast is Fast Riders? So that my party will not be late anymore.
Okay, at Fast Riders, what we do basically is we are optimizing logistics for the last mile delivery sector. We all know that the SME sector is one of the key players in the economy, right? We have so many small businesses, and logistics is a very, very vital part for that sector, because with bad deliveries, you might never get another business again. So for us as Fast Riders, we're ensuring that businesses are able to thrive. We provide them with tools to be able to thrive and also scale their business while not having to bother with the headache of where is my package, how do I move it? So convenience, security, and peace of mind is what we do at Fast Riders.
Okay, that's just to complain about my parfait. But let's go into the real business of logistics, planning and deliveries. Okay. What really goes into it, and what are the methods of transportation that are open to someone who is asking, I want to go into this field? So what's the to-do list, so to speak?
Okay, so basically logistics is actually very wide. So we have the first mile, mid-mile, but I am more focused on the last mile, which is the one that is not so capital intensive for people to come into, right? So in the last mile delivery, some of the vehicles that we use are usually motorcycles, because these are able to move small packages from one point to the other, and they are very, very efficient. Then other people also use trucks and also cars to move mid-sized packages for businesses as well. Now, for you to come into logistics, you need to understand that you have to be very, very calculative, because you're dealing with so many external factors, from having to deal with human factor is one major headache in logistics. But I think that we have been able to crack that in a way, because we understand that when people think of last mile logistics, they think of the regular Okada guys, and people already have this kind of notion about them that these people are below the pyramid, they are nobody. But for us, we try to give them a sense of belonging, that you're not just moving packages, you are somebody who is helping the economy to grow and to thrive. And how do you do this mindset shift for these people? Is by training them, by making them understand that you are doing something really, really small, but it has a very, very big effect. So from training of your riders, you need to be able to train them to make them understand that how to use technology as well, because we have mobile apps these days, and you have to train the riders on, route optimization, how to understand routes, because when you understand route optimization, you're able to save efficiently on fuel, so you don't get stuck in traffic. You use the fastest route to move and all of that.
Perhaps you want to explain route optimization to those watching.
Oh, okay. So route optimization, there are different softwares, and the major one most people use is Google. So we use Google, integrate Google to your mobile applications. It tells you the real-time real-time situation on the road, where to pass, the shortest kilometers, and routes to avoid. So yeah, Google, Waze. There's also Waze actually as well that people can actually leverage on when building their mobile applications for route optimization. And also you can also manage your fleet, right? Yes, fleet management. When you have your vehicles, you have to be able to put trackers, right? When you put trackers, you are able to manage and understand where your fleet are per time, and it also saves you cost, because if a rider or a driver moves in a direction that you don't know about, you're able to swing into action immediately and be able to retrieve your assets. Because for us at Fast Riders, we had a situation whereby somebody tried to pull a very funny stunt from Lagos. The bike was in Ibadan, and we're able to get it back through the right authorities. So yes, you have to put different infrastructure in place for these things to be able to work.
You have a calm man, and having to deal with dispatch riders, some would say it takes, you have to be really tough. So is this you on TV and then you dealing with the riders, a different person entirely? Because you talk really calm, and I'm imagining, how do you do it?
I don't know if I'm allowed to say this on TV. You need to be able to switch. It's more or less like you're going to have multiple personalities.
I see.
The professional part of it, because you're not only dealing with the riders, you are also dealing with touts on the road, right? So a rider might be cool, calm and collected today, but the challenges that he faces on the road might make him become somebody else. Just like the way we have downfall drivers in Lagos, you believe that these people, they are something else, but when they are with their families, they are different kind of people. So some of these external factors also affect us, and I think the government is already working with coalition groups, because logistics associations will liaise with the government to let the government know that these are the things that we face on the road. And Lagos State has been very, very proactive in helping us curb some of these touts that logistics operators encounter on the road. So yes, you need to be able to switch. You have to have like dynamic behavior.
I can tell you this.
To manage people.
I think on the list of people who have stressed Nigerians the most in 2024. And I mean this with every sense of, love. I mean, dispatch riders are very, very key to this economy. I can't tell you how much they have saved people. Yes. But on the flip side, I can't also tell you how much they have given people a headache. So logistic riders, maybe tailors. Logistic, they're at the very top. And I think you raised a very important point, ensuring that government is able to put structures in place that will not impede the work you do, that will not make the work, this already stressful work, even more stressful. So rather than have the touts, because they are sort of tax collectors, right? They're getting tax for government. How about you get it from the source? Rather than getting it from the streets. But then they'll tell you some people won't pay from the source. So that's why they're on the street as well. But we need to find an innovative way. You go to other climes, this is not how they enforce tax collection. But the other point I want to make is about how viable this is. Because it looks like a lot of young and old are now trooping into dispatch riders. Some even just get their motorcycles. I think, how many cc's? What's the limit for
200
200 cc's and above, right? A cc rather. They just get the motorcycle and they're doing the business. Is it viable? What does an average dispatch rider earn monthly?
Okay, I'm just going to give you a rough statistic.
Just an average.
These people are richer than me.
Say that again?
They are richer than me.
Than you, the owner of the logistics company. I'm
telling you. On an average, a logistics rider would cash in nothing less than, if he owns his bike, right, he will cash in nothing less than 360,000 naira or 400,000 naira a month, depending on how diligent he is and how efficient he is. He would cash out nothing less than 360,000. And I'll give you an instance. You don't really have to own the assets right away. So there are businesses that offer asset financing like we do, because we know that it is not easy in this economy to actually put in that bulk amount of money to buy a motorcycle.
How much is it, I'm sorry? Average again?
Averagely. So give or take, you're spending nothing less than 1.4 to 1.5 million naira to put together a dispatch bike. Yes, the bike, the box, and the documentation. How many people have 1.4 million naira? Yes.
Bukola is shocked.
Yes.
No, because I remember when motorcycles went for 250,000 naira.
Ooh, that was like 1980. I'm joking.
So yeah, like how many people have that luxury to put that amount down? But there are businesses like mine that are offering asset financing for these guys. And it might interest you to know that some of these guys, they've finished a cycle, they're already on the second cycle. Yes. So the already existing one, they've given it to somebody else, they've empowered maybe their brother from the village to keep riding, and they're making money. So yeah, it's actually a very viable industry. In as much as we have a lot of bikes on the road, it is still not enough to cater for the demand that we currently have. If you check during the Christmas period and the New Year period, it was a hassle to get logistics.
It was a mess, I can tell you that.
Even we that we run the business, even with our exorbitant fleet, we could not manage the demand that we had. So yes, there's still a lot of opportunities to be explored for both entrepreneurs, even the government too, because I know that there are infrastructure in place to ensure that the government can also make and generate income from this industry. For instance, in Lagos State, for you to have that signage on the box of your bike, you need to have LASA permits, and there are also, you need to have your Ministry of Transportation, what's it called, license to be able to move on the road.
How many of those? Because I saw someone one day brought out like 7, said this one,
they've
this.
been able to centralize it.
So how many do you pay for now?
So you have to do, from the top of my head, you need to have MOT, you need to have LASA, you need to have interstate carriage, you need to have your local government documents, you need to have your vehicle license, roadworthiness. I think
and all these are subject to renewal, for which you pay a fee.
Yeah, which you pay a fee for.
Every year.
That's about 6 or 7.
They also need to have a NIPOS license to be able to operate.
So I know you've spoken to this before. You talked about, instituting a tracker.
Yeah.
Somewhat into the vehicle, just to ensure some form of accountability.
Yes.
But then it just goes to show that how much profit would you be making anyway? Because it's reminiscent of transport business. When the people will say, "Oh, don't go into it. If you buy a bus and give it to a bus driver, they'll just be bringing back the bus to you. They will not be, bringing in returns." So how many motorcycles do you have in your fleet, and how do you ensure profitability amid so many challenges?
Okay, so for a business like ours, we ensure that there's a centralized payment system whereby you cannot shortchange the system. So we operate in multiple dynamics, like in multiple ways for our business. So we have the lease to own. So even if you're leasing to own, we are still able to manage you and understand that where you are per time. And also we have a platform whereby customers can come in, even other riders can also leverage on our platform to be able to maximize their income. However, there's a centralized system where all of this goes through so that money doesn't fall through the cracks. So, and thank God we have fintech products that are able to help you integrate all of this into your system. That way you're not able to lose money. Then for the trackers, I think there's an adage that says that penny wise, pounds foolish. So if you think that you want to save money by not putting a tracker, then you're going to be losing money, because these trackers are to help you, to secure you, and they are not too expensive. This technology is not too expensive. It's as low as 30 to 40K. You will get a tracker, a good tracker that you can use to manage your fleets, know where they are per time, and you can even turn off the motorcycle if the rider is going in a way that you don't want them to go. So these things are available for people to.
I think this is really cool, like remote control. That you're not going that returning up. But I need you to help us out here.
Okay.
Because as I said earlier on, it's been a very challenging 2024 with dispatch riders, but we want to have a smooth 2025.
Okay.
I know there's a responsibility of the me that I'm trying to use the dispatch rider, the logistics service, and there's a responsibility of the logistics rider. But first of all, why are logistic riders prone to failing, lying, delaying, mishandling or malhandling your, I could go on and on. Why? And what is it that we can do to help? I don't want to make it look like it's your whatever way you want to take it, fault alone. I know we have responsibilities as well, so help us meet halfway.
Okay, so this responsibility is for everybody, honestly, because as a business owner, if you are sending out your package as a business owner, you also need to understand the right packaging to use to package your products, right? So that it is tamper-proof, like nobody's going to tamper with it. So you need to have the right packaging for your product. You can't want to send soup and put it in, in a container that will make it spill, right? So there's that part. And also for we, the business owners, we have to consistently train our riders, consistently speak to them on communication, because you need to make them understand that they are businessmen, and that's what we've been able to do. That mindset shift is very important for other people in my industry too. Like, you don't just run your business like you're just moving packages. You are moving beyond packages. You are moving experiences. So you need to take time to teach your riders, even though some of them are illiterate, but you'll be shocked. The ones who you think are illiterate are the ones that are actually, more like they are more level-headed, and they are willing to listen. They are willing to improve themselves. So communication, you need to teach them on communication. You need to teach them on customer service, right? Yes, you need to teach them on emotional intelligence as well. Yes, because you need to teach them, because there are times a rider can keep calling a customer. When you keep calling, some people don't want to pick calls. So you need to tell them that you can send a text message to your customer to let them know that you're waiting for them or something. So it's a collective effort from both parties.
So logistics planning is not just about delivering packages, but also about delivering experiences.
Yes.
I can't forget that, and I hope that the riders are listening.
Oh, yes, they should be.
All right.
Thank you so much, Omowumi Omoshendini, co-founder, Fast Riders. Thank you for coming on the show.
Thank you for
having me. We hope to have you again.
Thank you.
All right, and so from this point, Jeffrey is up next for the next segment.
Yes, it's just part of the conversation carried on Bukola and our guest, of course, talking about logistics. And I'm sure that the issue of Shige should be reduced in 2025. So that's logistics. But let's come back. So it's also part of logistics in a sense, because this is using technology to make some level of advancement, because you talked about being able to remotely turn off some of the riders' motorcycles and all of that. So let's bring in our guest. Shehu Ebenezer is a data management professional. He joins us via Zoom from Sheffield in the United Kingdom. Mr. Ebenezer, thank you so much for coming on the program. Mr. Ebenezer, if you can hear me. Okay, we're trying to see whether we can connect with Mr. Ebenezer. So basically, this conversation is about the future of data. A lot is going on in the world of data. As a matter of fact, it's a two-pronged approach in Nigeria. The government is trying to say that they want to make as much, call it some level of penetration as far as technology is concerned, because it borders on a couple of things: communication, it borders on the economy, that's businesses, it borders on even national security, and there's several other factors. I can even add political stability when you talk about IREV and all of that for election management. So there are layers to the future of data. We also have the issues around multiplicity of all kinds of EIDs. You're talking about not IEDs, EIDs. I mean, virtual IDs. You have your NIN number, national identification number, you have your BVN, and they keep telling us to register this, register that. And sometimes we ask questions about how effective this is in fighting crime and criminality and terrorism insurgency across the country. So it's a potpourri of things that data management should be able to tackle. Internet penetration is another big deal. Let's bring in our guest. I understand he's ready for us now. Shehu Ebenezer is a data management professional. Sheffield, the United Kingdom is where he's joining us from via Zoom. Mr. Ebenezer, thank you for coming on the program.
Thank you very much for having me. Good morning.
All right, so there's a potpourri of issues I would like you to address. But basically, walk us through in just maybe a minute as to what data, the world of data looks like right now. So contextually, Nigeria, when we started, it was usually, when technology came in, I mean GSM, let me use the word GSM came in, we're more focused on phone calls, voice. now data is a big deal. So what is the global context of all of this?
The global context for data would be that data is a byproduct of technology, right? And over time, data is generated, historically, every activity that is in information oriented generates data as a byproduct. Data begin to give more than just statistics, but also insight, foresight, and nations across the world are harnessing, businesses across the world as well, are harnessing the power of insight and foresight through data. That is driving innovation, and that is driving technology, and that will continue to be the trend for eternity, I suppose, because more information brings more ability to do more, to produce more, to be more efficient, to have more less cost, because now you understand where most of your bills are coming from. You are innovative of how to reduce those bills. You are innovative of how to improve your operations, maximize profit, and play out the global market, I suppose. So data is here to stay.
Absolutely, data is here to stay, but there are concerns to this advancement, Mr. Ebenezer, which I want you to address as serious as possible, because there's a report we got that the world of internet fraud or wired fraud should be about in trillions of dollars. I mean, constituting a significant part of the world's GDP. That's how scary it is. So when people put out their cards now, they are concerned.
National economy is on.
So talk to us about data security, because people are quite skeptical putting out their information out there because they don't want to be hacked and get access to the little money they have.
Yeah. I think data security, from my experience and my profession as well, is a two-edged sword, if I put it that way. There is a part for the government to play in security, and last year I was speaking at Nigeria, on data protection, implementing the NDPR regulation. And so data protection or data security is a governmental response to the people, is a need. Another side to it would be an organization, and the other side to it would be individuals. Everyone has a role to play in data protection or data security. The way people release their password, the way people use their own personal devices would show if they are prone to security, mishaps or not. The way government structures infrastructure around data and internet and all this infrastructure will determine how ready they are to mitigate this risk. They are here to stay. Some people use the way some people would drive a car very well and they'll drive right on the road. Some people will drive the same car and will cause trouble for people. So everyone has the right, to safety on the internet. Government should provide those infrastructure that help to mitigate that. Internet providers, ISPs, and all of them should provide security measures from their end to mitigate, people who are trying to penetrate their system illegitimately. And then people should also be internet wise the way they release their information, because most of the time hackers and all these people subtly approach people through either junk mail, either spam mails and all that to ask for something that seemed legitimate, but at the back of those intentions is to steal their data, have access to their information or to their devices, and then do them harm. So information security is something that's nations across the world are battling with, because this sort of mishap is re-evolving itself from somebody, people still call you now and ask you to come and join one Zoom meeting that's after everybody is known that it's rubbish. So people need to be security aware and trained to know what are the patterns of these scammers. And this government can also do more by bringing policies and standards that safeguard people on the internet.
At the end of the day, we're looking at reducing the bites on the pocket via wired fraud. And let's look at another part, looking at Nigeria, for instance. And I want you to speak to data harmonization. We have NIN, we have BVN and all sorts of things, and yet we still have some of these things happening. I'm contextualizing it based on the issues around security. For instance, the New Year Eve, the guy that drove into one of the cities in the United States, in minutes or in hours, they were able to find a lot of things about him because of harmonization. How do we do that and be effective in Nigeria? Because things happen, and sometimes we can't trace these things, and yet we have all kinds of numbers, BVN and NIN.
Nigeria is such a data-rich country. It's unfortunate that we are not harnessing and harmonizing this data. People were forced to have BVNs, NIN, and all that before they can have a phone service, before they can open a bank account, and yet we are not using that in our forensic investigations to track people down to know locations of criminals. We still have people making phone calls to collect money as ransom, and yet we are still looking for them. I mean, we are sitting on gold mine of data from governance point of view, which I believe the country should begin to think of harnessing right now. There is so much potential that we have loaded data in servers and systems, but they are only sitting down there dormant. I think government should begin to think of how to harmonize this information. We have people with passport, people with licenses, even market women that have POS and all that. There is so much data everywhere that we can begin to link these portals together to connect dots, to find locations, to trace activities on the internet, and to be beginning to do a lot of policing via data and via integration. All right,
Mr. Ebenezer, in 30 seconds, where do you see our level of penetration by 2025? I know that the Renewed Hope agenda in the President's manifesto had some aspiration as to the level of penetration. What do you expect? Because elections are coming. We don't want to hear stories that there were glitches. When it comes to other things, the penetration is huge. When it comes to election, we begin to tell stories.
Well, that would be something that the government would be more determined to do than to make those promises. I believe that the information, the minister and the Minister of Information, Minister of Communication at this time should harness the power of the internet that they have to structure how the next election, for example, would be, how the next, how communication during an election should be. Now, people can tell what communications are going on. When people are trying to, there is voice in data, for example, in internet. So when there is some sort of conversations, they can eavesdrop on this conversation, block certain mishaps happening in the country, in the life politics and all that. So there is a lot to do. I hope that they are ready to not just talk, but walk the talk.
Omar, thank you so much. We'll have to bring you back. There's a lot more to talk about. Seun Ebenezer is a data management professional joining us via Zoom from Sheffield in the United Kingdom. Thank you, sir, for coming on the program.
Thank you for having me.
All right, so, hey, Kayode, you can hear there's a lot. I talked about the election. All of a sudden, polling booths are found everywhere during election, but data penetration is always an issue. So we don't want to hear excuses.
At all. We don't have room for excuses this time around. And, you said, as you heard, Kayode, and that just takes us right to our next segment because it concerns hearing. Jeffrey, we have joining us on the show this morning, as you may have caught a glimpse of him already. His name, Pius Olamilekan Fatoke, a sound recordist, over 15 years in television, film production industry as a sound recordist. Good morning, welcome to the Morning Brief.
Good morning, Karen.
First things first, what is a sound recordist? I imagine for some people, it's probably the first time they're hearing this. They know it is important, they probably know it already, but maybe they need to link it. Who is a sound recordist?
Okay, a sound recordist is the guy in charge of the audio on set, on a film, television set. He knows the corners, he knows the angles to take his mics to or to position his mic, you understand? And if it is not clear, it cannot be heard. You understand? So you can record a bad picture, but you can never listen to a bad sound. So a sound recordist must be a guy that knows his job. He knows when his meter is peaking, and he knows when the background noise is overriding his main audio. So he should be able to have a very good ear. So I always tell people that I see through my ear, not through my eyes. So I listen and I see what what is good to take a good sound.
Brilliant. So here's the thing. I have a bias. for what you do.
Okay.
You know why? I started with production.
Okay.
I started with audio, and I always tell people exactly what you said. You can manage a bad picture, right? But it won't work if the audio is bad. It's like watching me right now, and I'm you're going to tune off like what's going on. So the work you do is really vital. That's why I have a bias for you. I should even be sitting there, so Bukola would just be alone here. But you worked on Everybody Loves Jennifer.
Yeah, I do. I work on Everybody Loves Jennifer, and I work on 7 Doors. I work on Jagun Jagun. I work on 93 Days. A countless of movies or
the question is, what did you not work on? Because these are literally
the leading productions,
right? So it must have been a busy 2024 you had.
Well, every year I think I give glory to God that it has been a busy year for me all through my career. It's over, now it's more than 20-something years. But you know, we started when Nollywood never believed that there's a need for a proper audio from sets. You understand? Before you even go to post-production. You know, we started when they don't even do final mix. So
what did they used to do then?
Then it's just taking the raw audio and go to straight to the edit. So you must get it right. There is no chance for you to make a mistake.
So getting it right means also that there must be a lip sync between the video and the audio, right?
So you must have the lip sync. So you must know whether you are recording on the same frame with the picture. So if you are not synced with the pictures, that means you're not doing the right thing. You're not the right man for the job.
So tell us how the technology has evolved from that time to this time. What are the different sets of technology, that has caused an advancement in sound recording?
Okay, now I think technologies are already moved up for us, and it has made it more easy and more simple in the way that you understand it. You understand? Then we are doing more of analog. Now it's more of digital. So you need to move from a step ahead. So you must know your equipment. You must know what your post-production guys need to work on. You guys need to have a meeting that is called pre-production, post-production. So everything, you must follow your job till end of it. So technology has made it more easier for us to follow our job through that process.
So besides what's the name of that guy in the production value chain for movie making that is like a god?
The focus
guy.
Okay,
the sound recordist is also another god on set, because if sound fails, everything fails.
Yeah. So, and Nigerians, we are not used to ADR because in Hollywood or Bollywood, they are used and they are trained to ADR. So they will always
please wait.
What's ADR?
Tell people what ADR is.
Okay, so ADR is automated audio replacement. So for instance, maybe director or production or the EP doesn't like the way I sound. They can have an actor to come and reproduce or re-record the audio and place it, and it will be synced. So most of Hollywood movies are more on ADR.
Okay, so without the picture, if there's an issue with audio, the director can get the actor to return to do the audio version
but it must be lip sync. There must be audio for them to be able to replace the other audio. So if it is not in sync, if it is not being heard, there is no way it will be easy for anybody to be able to do that.
And I guess those are in extreme cases where there was failure in a portion of the audio.
Yeah.
Well, you just said something which is very important, that in Bollywood, that's what they do. They're big on ADR.
Yeah.
Even in Hollywood as well.
Yeah.
I've seen movies that you can tell sometimes that this audio was not taken on site while filming. It was done afterwards. But that means you have to replace the ambience.
Yeah,
Maybe have to shoot in the same place.
That's the trick. You need to record the ambience when when you are working. So there are always times that you as a sound recordist, you tell the AD or the director that you need the ambience for the post-production to be able to work on anything they want to work on. So you just taking out the ambience and putting somebody else to come and do it. So you still have those acoustic ambience, well knitted, that is not overriding your audio in any case. So you won't be overriding your dialogue. You'll be feeling it like, oh, I'm in a market. I can see people saying, oh, come and buy this, come and get this. So that natural ambience is there. It's not just you went to go and generate it from anywhere.
Part of me, it's an important point you're making. And what we've been trying to do over the past few days is help people understand the work that happens behind the scenes.
Yeah.
You just take it for granted that a movie is produced, but people don't realize that the scene is shot, and then post-production you do ADR, voice over it again, and you have to make sure that it sounds the same emotions for the actor, the same enunciation and the rest, the same thing, so people don't notice, and it has to sync.
Yeah.
But I've noticed something, and this is heartbreaking. You see fantastic work, but as you're watching the movie, you realize that the audio is bad. And I'm not trying to pull down anybody's work. I know a lot of work goes into it. Nobody goes out to shoot a movie and you want the audio to be bad. But because of some circumstances, things happen and you just have to go. You can't waste millions of naira or sometimes dollars.
Hundreds of millions of naira.
Down the drain, right? So what exactly is the main challenge? Is it the mic that is used? Sometimes I know you use lav mics, they hide it, or you can use a boom mic or shotgun mic. What exactly happens that lovely pictures but bad audio? And some of them are on streaming platforms right now, but you're like, why? Why is the audio bad?
Well, two things involved. One is either bad equipment or you hire you hire the wrong person. Nigerians, we are used to, let my people do it. Or I can't afford AYZ and I can't afford this person. You understand?
Yeah. The
only thing there that I tell EPs or producers that, hire the right people. Put them in tests. There's no big deal in it. I can have my CV written in many names, but did I do a physical job that you should need to put me on test? So put them on test. Let's see. There's no time for us to waste money and resources. Some actors are not even available. Their calendars are booked throughout the year. Some crews are booked throughout the year. So you should know how to hire the right person at the right time. Then you yourself, don't let them give you what is just, how will I say it? Don't let them serve you food that you won't want to take.
So to guarantee the fidelity of sound for a production, a critical production, and your name as a sound recordist, what are the standards that you insist on in terms of the kind of equipment that they make available to you? Or do you own even your own equipment so that you can say, this is my work and I'm putting my name on it?
Yeah, I own my own equipment and I own my own company, you understand? And I do tell people that hired me, and I'll tell them, this is the A lists that I can go for. And these are the things. After I've read the script, digest it, break it down, I know what and what I need. And I tell them, this is SY amount of mic I need, and for the location recce that I've done, I can see, there's a construction building going on behind when we want to go and film. These days, can they give us so time? Can we talk about it? You understand? All those measures needs to be done before you even go into setting. If it's not working for sound, I will advise the production, this location, it's not going to work.
Yeah.
You understand? So it now depends on production to tell me, Pius, you will come, won't be able, we love the location, but the only thing we will need to do is that, let's mark it ADR scenes.
There you go. It's beautiful to hear the work that goes into all of our big movies, and we have to thank you for that work you do.
You're welcome.
By the way, I use an AI already because I think AI can help in ADR.
AI will not help Nigerians in ADR, you know.
It won't help you.
It will help you.
All right, Mr. Pius Fatoki, sound recordist. Thank you so much for your time.
You're welcome.
I wish you the very best. I know it's a full year you have already, 2025.
Thank you.
Thank you so much. And we have Jeffrey joining us.
Maybe you could be your assistant, you know, considering the millions that is quoted in the film industry these days.
No problem, but you know, Hall is not going to the crew.
And Jeffrey joins us. I'm sure Jeffrey
I always like the money
conversation.
parts. Yeah. I like numbers and money. Thank you for what you do in developing our industry.
Thank you.
All right, guys.
There you have it. What a show we've had today. Thank you for being a part of it. I'm Kayode Okikiolu. Thank you for joining and have a great day.
Of course, Sunrise Daily is up next. Thank you so much for being there. We'll be back again tomorrow. I am Bukola Koka.
Don't worry, it's 8th of January, 31st is coming.
Yeah.
Bye-bye. I'm Jeffrey Uzama.